Absolutely. It's such a big misconception. You get women coming and said all the time saying, I had a partial hysterectomy. Well, what they really, in most cases, mean is they left my ovaries behind. Okay, if you look at and I was going to bring a picture because it's so important. If you look at the female reproductive organs, you really have four. What is it? Yeah, cervix, the uterus itself or the lining. You have fallopian tubes and you have an ovary. Now they're all kind of connected together, but they have their own cancers, their own risk for cancer, and their own individual function. But they're all kind of attached, but they're not the same organ. So the hysterectomy really means removal of the uterus along with the cervix. That's all it means. If we talk about hysterectomy with salpingectomy, the salpingectomy is a big medical term for the tube. Okay? So if I do a hysterectomy with salpingectomy, I'm taking your tubes. If I do hysterectomy with salpingectomy and oophorectomy, I know, I love it. You know, it's just these names are kind of crazy, but that's what they are. I'm taking everything. That's when I'm taking the ovaries, the tube, and the uterus. But hyster really means uterus. So just where the baby's kept and the cervix, where we do pap smears, that's essentially your uterus. So if you're getting a hysterectomy, that's in understanding that's all that's coming out. And most women are concerned about that because obviously they say, oh my God, I'm going to have to start taking hormones and I'm going to grow beards and all these kinds of things, right? No, we leave your ovaries behind if you decide that's what you want. And you go into the situation of, do you want them or not? Your risk of ovarian cancer is approximately 1% unless you have a family history. If you have a family history, that can be as high as 10 or 11% or even higher depending on other things. But the basis is 1%. So most women will say, well, I'll probably leave them in. Now, if you're 51 and you're having surgery, you're right at the average age of menopause, and you may say, well, at this point in time, I might as well have them removed, right? The other thing that we do now, which is a little bit different on the last few years, is we typically will take the tubes. In the past, when we did just a hysterectomy, we would leave, we would kind of, because they all kind of connect to the side of the uterus, we would just kind of come down, disconnect, take the uterus out. Now, because there is information that says that the end of the tube actually interacts with the ovary, which may initiate ovarian cancer in a woman who's going to develop cancer, we take we take the tube out, because obviously if we're taking the uterus out, she doesn't really need her tubes. So we take all that out at the same time. So that's probably the slight change that we've made. But many women come in talking about the hysterectomy and assuming that everything is going to be removed. But they are really individual organs with different cancers associated and risk associated with it.